Chase is in the hospital, unveiling the medical realism in Paw Patrol The Movie. WAP, watch this video. Ever wondered about the real-world implications behind the animated adventures of our favorite Paw Patrol characters? Let's dive into a detailed exploration of Chase's hospital visit in Paw Patrol The Movie, examining the medical scenarios and their potential educational value. Paw Patrol, known for its vibrant animation and engaging storylines, introduces children to the world of emergency response. The show often depicts scenarios requiring quick thinking, teamwork, and problem solving, all crucial elements in real-life emergency situations. Each character embodies a specific role, from police work to firefighting, providing a simplified yet informative overview of various professions. This helps young viewers understand the importance of community helpers and the services they provide. In Paw Patrol The Movie, Chase finds himself in a situation that leads to hospitalization. While the specifics are tailored for a young audience, we can analyze the potential underlying causes and medical responses from a more informed perspective. Was it an accident during a rescue mission? Or perhaps an unforeseen health issue? Understanding the context of his injury or illness is crucial to appreciating the subsequent medical care depicted. It's important to distinguish between the medical realism and the cartoon fantasy elements in the movie. While the show aims to entertain, it also subtly introduces concepts of health and safety. The medical procedures shown might be simplified, but they can serve as a starting point for discussing real-world medical practices with children. This can help demystify hospitals and medical treatments, reducing anxiety and fear. Let's explore some potential injuries or illnesses that might have led to Chase's hospitalization. This section will provide a detailed educational overview suitable for both beginners and those with some medical knowledge. Traumatic injuries, such as fractures, concussions, or lacerations, are common in emergency scenarios. These injuries require immediate medical attention to stabilize the patient and prevent further complications. In Chase's case, a fall or collision during a rescue mission could result in a fracture. The treatment would involve immobilization, pain management, and potentially surgery, depending on the severity. Infections, such as pneumonia or sepsis, can also lead to hospitalization. These conditions require prompt diagnosis and treatment with antibiotics or other medications. If Chase contracted an infection, the medical team would need to identify the source and administer appropriate treatment. This highlights the importance of hygiene and preventative care. Allergic reactions can range from mild to severe, with anaphylaxis being a life-threatening emergency. Exposure to allergens can trigger a rapid immune response, leading to breathing difficulties and shock. If Chase experienced an allergic reaction, the medical team would administer epinephrine and other medications to stabilize his condition. This underscores the importance of knowing potential allergens and carrying necessary medications. The movie likely depicts various hospital procedures, albeit in a simplified manner. Let's delve into the real-world equivalents of these procedures, providing an educational overview for viewers of all backgrounds. Upon arrival at the hospital, Chase would undergo triage, a process of assessing the severity of his condition and prioritizing treatment. This ensures that the most critical patients receive immediate attention. The medical team would assess his vital signs, such as heart rate, blood pressure, and respiratory rate, to determine the extent of his injuries or illness. This information guides subsequent diagnostic and treatment decisions. Diagnostic imaging, such as X-rays, CT scans, and MRIs, plays a crucial role in identifying underlying injuries or conditions. These technologies allow medical professionals to visualize internal structures and detect abnormalities. In Chase's case, an X-ray could reveal a fracture, while a CT scan could identify internal bleeding or organ damage. These imaging techniques provide valuable information for accurate diagnosis and treatment planning. Medication administration is a fundamental aspect of hospital care. Medications can be administered orally, intravenously, or through other routes, depending on the specific drug and the patient's condition. Chase might receive pain medication to alleviate discomfort, antibiotics to treat an infection, or other medications to manage his symptoms. The medical team would carefully monitor his response to these medications. In some cases, surgical interventions may be necessary to repair injuries or address underlying conditions. Surgery can range from minimally invasive procedures to complex operations, depending on the severity of the situation. If Chase sustained a fracture requiring surgical repair, the orthopedic surgeon would perform the necessary procedure to stabilize the bone and promote healing. Post-operative care would include pain management and rehabilitation. The movie highlights the importance of medical professionals, such as doctors, nurses, and paramedics, in providing care and support to patients. These individuals play a critical role in saving lives and improving health outcomes. Doctors diagnose and treat illnesses and injuries, while nurses provide direct patient care and administer medications. Paramedics provide emergency medical care at the scene of an accident or illness and transport patients to the hospital. Hospitalization can have a significant psychological impact on patients, especially children. Fear, anxiety, and separation from loved ones can contribute to emotional distress. The medical team would provide emotional support and reassurance to Chase, helping him cope with the stress of hospitalization. Child life specialists can also play a role in providing age-appropriate activities and support to young patients. Recovery and rehabilitation are essential components of the healing process. Physical therapy, occupational therapy, and other rehabilitation services can help patients regain strength, mobility, and function. Chase would likely undergo physical therapy to regain strength and mobility after his injury or illness. The rehabilitation team would work with him to develop a personalized plan to achieve his goals. Paw Patrol The Movie provides educational opportunities for children to learn about health, safety, and the importance of medical care. Parents and educators can use the movie as a starting point for discussions about these topics. By watching the movie and engaging in related activities, children can develop a better understanding of the human body, common illnesses and injuries, and the role of medical professionals in their community. Paw Patrol, the movie, offers more than just entertainment. It provides a platform for discussing important real-world concepts. By analyzing Chase's hospital visit, we can gain insights into medical procedures, the importance of healthcare professionals, and the psychological aspects of illness and injury. This exploration bridges the gap between cartoon fantasy and medical realism, offering valuable educational opportunities for viewers of all ages. Let's use this as a springboard to further explore the fascinating world of medicine and healthcare. Ready to take your understanding of emergency response and medical care to the next level? Share this analysis with your friends and family, and let's start a conversation about the real-world implications of our favorite animated adventures. Dive deeper into medical topics by researching specific injuries and treatments online, or even consider volunteering at a local hospital to gain first-hand experience. Together, we can transform entertainment into a powerful tool for education and awareness.